Did you know that over 50% of bloated cows can be saved with a simple rumenotomy? Bloating in cows is a common issue that can lead to severe discomfort and even life-threatening conditions if not addressed promptly. The rumen, which is the largest stomach compartment in a cow, can become distended with gas, causing the animal to bloat. This condition can be caused by a variety of factors, including diet, sudden changes in feed, or even certain types of plants. But don't worry, with the right knowledge and tools, you can perform a rumenotomy to relieve the bloat and save your cow's life. Let's see how. The rumenotomy procedure might sound daunting, but it's quite straightforward when broken down into simple steps. First, it's essential to understand the anatomy of the cow and the location of the rumen. The rumen is situated on the left side of the cow's abdomen, and this is where you'll be focusing your efforts. The goal of the rumenotomy is to create an opening in the rumen to release the trapped gas and relieve the pressure. This procedure can be a lifesaver, especially in emergency situations where a veterinarian might not be immediately available. First things first, ensure your cow is calm and restrained. A stressed or agitated cow can make the procedure more difficult and increase the risk of injury to both the animal and the handler. Use a halter and secure the cow in a chute or against a sturdy fence. Speak to the cow in a soothing voice and move slowly to avoid startling it. The more relaxed the cow is, the smoother the procedure will go. Safety is key here, folks. Before you begin, make sure you're wearing appropriate safety gear, including gloves, a surgical mask, and protective eyewear. This not only protects you from potential hazards, but also helps maintain a sterile environment, reducing the risk of infection. Remember, a clean and safe working area is crucial for the success of the procedure. Next, shave and clean the left paralumbar site. This is the area where you'll be making the incision, so it's important to remove any hair and thoroughly clean the skin to prevent contamination. Use a surgical scrub and antiseptic solution to disinfect the area. This step is vital to minimize the risk of infection and ensure a smooth surgical process. This is where the magic happens. With the site prepped and ready, you're all set to begin the procedure. It's amazing how a few simple steps can make such a significant difference in the health and well-being of your cow. Now make a careful incision about 6 to 8 inches long. Use a sharp scalpel and make a clean cut through the skin and underlying tissues. It's important to be precise and controlled in your movements to avoid causing unnecessary trauma to the cow. Take your time and ensure the incision is straight and even. Don't worry, the cow won't feel much if you've used a local anesthetic. Administering a local anesthetic will numb the area and make the procedure more comfortable for the cow. It's always a good idea to consult with a veterinarian beforehand to determine the appropriate type and dosage of anesthetic to use. This step is crucial for the cow's comfort and well-being. Gently cut through the skin and muscle layers until you reach the rumen. As you make your way through the different layers, be mindful of the cow's anatomy and take care not to damage any underlying structures. The goal is to create a clean and controlled opening that allows you to access the rumen without causing unnecessary harm. Once you see the rumen, secure it with stay sutures to prevent any spillage. Stay sutures are temporary stitches that hold the rumen in place and prevent its contents from leaking into the abdominal cavity. This step is essential to maintain a clean surgical field and minimize the risk of infection. Make sure the sutures are tight and secure before proceeding. This step is crucial to keep the operating area clean. Maintaining a sterile environment is key to preventing complications and ensuring a successful outcome. Use sterile drapes and instruments and avoid touching anything that isn't sterile. If you do accidentally contaminate something, replace it with a new sterile item before continuing. Now, make a small cut into the rumen itself. This is the moment of truth, where you'll be releasing the trapped gas and relieving the pressure. Use a sharp scalpel and make a precise incision, being careful not to cut too deeply. The goal is to create an opening just large enough to allow the gas to escape without causing further damage to the rumen. Be careful. This is where the gas and pressure will be released. You might notice a sudden rush of gas escaping from the rumen, which is perfectly normal. This release of pressure can provide immediate relief to the cow and is a sign that the procedure is working. Keep an eye on the cow's condition and be prepared to take further action if needed. You might notice a lot of gas escaping. That's perfectly normal. The release of gas is a good indication that the rumenotomy is successful and the cow is on the road to recovery. Continue to monitor the cow's condition and be ready to address any additional issues that may arise. Next, carefully remove any foreign material or excess gas causing the bloat. Sometimes the bloat can be caused by foreign objects or undigested feed that has accumulated in the rumen. Use your hands or surgical instruments to gently remove these materials, being careful not to cause further damage to the rumen. This step is crucial to ensure the cow's long-term health and prevent future episodes of bloat. This is the part where you need to be gentle but thorough. Take your time and make sure you've removed all the foreign material and excess gas. The more thorough you are, the better the cow's chances of a full recovery. Remember, patience and attention to detail are key to a successful rumenotomy. Finally, sew up the rumen and then the outer layers of muscle and skin. Use a sterile needle and suture material to close the incision in the rumen, making sure the stitches are tight and secure. Once the rumen is closed, proceed to stitch up the muscle and skin layers, taking care to align the edges properly. This step is crucial to ensure proper healing and prevent infection. It's like closing up a zipper. The goal is to create a neat and secure closure that will heal well and minimize the risk of complications. Take your time and make sure each stitch is placed correctly. A well-closed incision is key to a successful recovery. Make sure everything is nice and tight to prevent infection. A tight and secure closure will help keep bacteria out and promote faster healing. After you've finished stitching, apply an antiseptic solution to the incision site and cover it with a sterile bandage. This will help protect the wound and reduce the risk of infection. And there you have it. The rumenotomy procedure is complete and your cow should be feeling much better. Keep an eye on the cow over the next few days and watch for any signs of complications, such as swelling, redness, or discharge from the incision site. If you notice anything unusual, contact a veterinarian immediately. Your cow should be feeling much better. With the pressure relieved and the foreign material removed, the cow can start to recover and return to its normal activities. Make sure to provide plenty of fresh water and a balanced diet to support the cow's recovery. Remember, always consult a vet if you're unsure about any step. While a rumenotomy can be performed by a knowledgeable farmer, it's always best to seek professional advice if you're uncertain about any part of the procedure. A veterinarian can provide valuable guidance and ensure the best possible outcome for your cow. Thanks for watching and happy farming. We hope this guide has been helpful and that your cows stay healthy and happy. Remember, a little knowledge and preparation can go a long way in ensuring the well-being of your livestock.